A home health nurse is visiting a patient who recently suffered severe. So there is cerebrovascular accident, that is stroke. The nurse would most likely implement which of the following interventions to prevent muscle and ligament deformities. So the patient can have muscle and ligament deformities after a stroke. So what are the so with this question, see it is with muscle, like something has happened with the muscle, so you are going to prevent the deformity of the muscle, so it is an intervention, so you should have it should be an exercise. Okay, so this ROM exercises are the most commonly used exercises as physio for the prevention of disability that has happened during stroke. So daily moist heat and isometric exercises, daily balance training. So these are little, higher end of training, isn't it? Daily balance training. Instruct the patient to use non-affected side to perform the activities of daily living. That's all true, but the most likely. So that there itself you have a keyword. What is that? Most likely. Most likely will be range of motion exercises. Okay. Next one. A nurse is assigned to do a home visit for a 81-year-old patient. So it is an elderly patient. The patient lives at home with an adult caretaker and is completely bedbound following a CVA. So patient has had stroke and the patient is completely bedbound and it has happened 2 weeks ago. In planning caregiver education, the nurse should be prepared to instruct the caretaker in. So, you are going to give some education to the caretaker. What is it? How to select a nursing home for the patient, perform passive range of motion. So, I told you already, isn't it? Most of the time, when you have stroke questions, and if it is about an intervention, then mostly the answer will come as ROM. Okay, so this can be a trick. The importance of avoiding viscous drinks, forming a local chapter of a caregiver support group. So it should be ROM. So most of the time when the question is about CVA, okay, some muscle injury, the most commonly used intervention is range of motion exercises. A home care nurse makes a follow-up visit to a patient who have recently suffered CVA. So the patient has got CVA. The patient is mobile and able to perform activities of daily living. The patient is mobile and the patient can perform the activities. Everything patient can do. Patient can walk, patient can do the things. However, the patient has not sleeping and has lost weight due to lack of appetite. So the patient is not hungry, the patient's weight is, patient is losing the weight, patient is not sleeping, so these things, the patient has also overwhelmed with the sadness. So when things like this comes, when a question is asked and it is associated with the symptoms of like this, like depression, we say these are the symptoms of depression where we have helplessness, hopelessness, and worthlessness. Okay, you feel you are not worthy to live, you don't have hope, you are helpless. So when a patient is affected with CVA, so symptoms of depression is always associated. So the answer will be patient needs intervention for depression. So this is another very common question. Okay, the next question. The patient is admitted with the CVA, is unable to chew or swallow. The patient cannot chew or the patient cannot swallow. The patient is at risk of aspiration. The nurse would anticipate receiving which of the following orders for this patient. So, patient cannot chew, patient cannot swallow, the patient is at high risk of aspiration. What it would be? Nil per oral, isn't it? Nil per oral. Give no food by mouth and start intravenous hydration. Don't give any food by mouth. Start a puree diet with thickened liquids. Never. Refer the patient to a psychiatric for depression related to CVA. This can be there, but in the later phase, Refer the patient to physical therapy for muscle strengthening. This can also happen, but in the later phase. So, this will be the immediate one. Give no food by mouth and start intravenous hydration. When the nurse is administering a large volume enema, the patient complains of cramping. The nurse should lower there is a large volume enema. Okay, so what is the answer? Lower the fluid container. Okay, so the patient is here. You have a bed, suppose, and you have the patient here. Patient is lying down, and mostly you will have the side lying position with the leg flexed, and the nurse will be standing. Suppose the nurse is standing here, and this is the enema can, which is attached to the. So you have the patient's bowel. So you have the fluid that is flowing into the patient's bowel and into the intestine. So this is how the fluid is going. So the patient is complaining of pain. Patient is saying, "Oh, I am getting pain." So now what you should do? You should this fluid container which the nurse is holding should be held low. Okay. So that is important. Lower the fluid container. Very important. Okay. A home health nurse has entered a home to complain an admission assessment on a patient who has methicillin resistant staphylococcus urinary tract infection. So the patient is having MRSA urinary tract UTI. The patient will receive anti-infective, which is our antibiotic via peripherally inserted catheter. So PIC is there for 3 weeks. Which of the following action immediately? The first one, patient is having UTI, antibiotic is running, you have a catheter, so mostly what it will be? It should be hand hygiene, isn't it? So now you can filter, shake the patient's hand. Now, place the nursing supply bag at a clean dry surface. No. Obtain the patient's written consent for home health care. Okay, this can be, but little later. First is what? Perform hand hygiene as per. So this is the first thing. Okay. A home health nurse is teaching a family member about the care of PICC. PICC is patient's peripherally inserted central catheter. Which of the following statement would be appropriate for the nurse to make? Place the used IV tubings in a leak-proof container and then place the sealed container inside a second leak-proof container. You will need to put on a disposable face mask before you connect the IV tubings to the port of PICC. The port of PIC catheter will need to be cleansed with povidone iodine after the infusion is completed. So, disposable face mask is not at all needed for this. The empty medication container can be placed in the same container as your house. No. Place the use, so this is about the disposal, how you dispose. Place the used IV tubing in a leak-proof container. So you should use the tube in a leak-proof container and then place this sealed container inside a second leak-proof container. So you should place the tubing in a leak-proof container and this has to be kept in another leak-proof container. So this is how it should be disposed. So this is about the disposal.